Hello, welcome back to head and neck classes. So we shall continue with the deep structures of the neck, midline structures of the neck and thyroid gland. So midline structures are mainly formed by the cartilages of the larynx. There is the thyroid and cricoid cartilage which continues to form trachea. And we can see the thyroid gland, it is an endocrine gland approximately with 25 grams weight. And the dimensions we can remember as 5 into 3 into 2, 5 centimeters length, 3 centimeters width and 2 centimeters thickness. And it extends into the neck as the apex. The two lobes are connected by means of isthmus. The apex extends till the oblique line of thyroid cartilage. And the thyroid gland is the only endocrine gland which depends on the extraneous raw material, that is iodine. So it is the only endocrine gland which depends on the iodine, which is the external environmental factor or extraneous raw material. And it produces, we know it produces T3 and T4 hormones. So here in the midline structures, we can see the hyoid bone, and the hyoid is thyroid cartilage is connected by means of thyrohyoid membrane, and thyrohyoid membrane is pierced by superior laryngeal vessels. And it is also pierced by a nerve which is called as internal laryngeal nerve. The nerve along with the superior laryngeal vessels is which supplies the interior of the larynx. It is a sensory nerve which supplies the interior of the larynx till the level of vocal cords. And other midline structures, as I said earlier, thyroid and cricoid cartilages are there. And thyroid gland, it is roughly having pyramidal lobes, and this is the accessory lobe of thyroid gland, which is an inconstant lobe which may be present, may be absent. And so that is about the midline structures. And we can see the trachea as well. And trachea is connected to the cricoid by cricotracheal ligaments, and cricoid is connected to the thyroid by cricothyroid membrane. So in cross section, we can divide the neck structures, the deep structures in the neck, as the endocrine layer, respiratory layer, and the alimentary layer. So endocrine layer includes the parathyroid and the thyroid glands, and then respiratory layer includes the larynx and trachea, and alimentary layer includes the pharynx, which continues down as the esophagus. So the extent of the thyroid gland is from C5 to T1, means the root value of brachial plexus. You can remember as the root value of brachial plexus. From C5 to T1 it extends, and the apex extends till the oblique line of thyroid cartilage, that is present at the level of C5. And below it extends till the T1, till the fourth tracheal ring. And isthmus is related to the tracheal ring of T2 and T3 tracheal rings, third and fourth tracheal rings. Coverings of the thyroid is covered by a false capsule and true capsule. The true capsule is the inner capsule, this green lining is the true capsule, which is derived from the connective tissue of the gland itself. So the stroma of the gland gets condensed to form the true capsule, whereas the outer capsule is the false capsule, which is derived from the pretracheal layer. So the false capsule is derived from pretracheal layer of deep cervical fascia. And a portion of the false capsule, that is the pretracheal fascia, is connected to the cricoid cartilage. You can see it is connected to the cricoid cartilage by a suspensory ligament of Berry, or posterior suspensory ligament, which keeps the thyroid gland intact with the trachea and the larynx. So during deglutition, the thyroid gland moves up and down because of this ligament. And the structures between the true and the false capsule includes the parathyroid gland, and the deep to the true capsule we are having venous plexus of the thyroid, which are called the thyroid venous plexus. So that is the major difference between the venous plexus of the thyroid gland and venous plexus of prostate. In the venous plexus, like in the prostate gland, the venous plexus are located between the true and the false capsule. So during the removal of prostate, the false capsule is true and false capsule both are kept intact. So it is scooped around the urethra. We know the prostate is a gland present around the first part of urethra in males. So it is scooped from inside the urethra, keeping the both the capsules intact to prevent any hemorrhage. And here in thyroid gland, the venous plexus are located deep to the true capsule. The venous plexus are located deep to the true capsule. So when we are removing the thyroid during thyroidectomy, the capsule is also removed along with the thyroid gland, so to prevent hemorrhage. So this is the major difference between the venous plexus of thyroid and venous plexus of prostate gland. So we can see here the relations and the blood vessels related to the thyroid gland. Posteriorly, the thyroid gland, posterolaterally, posterior border of the thyroid is related to the carotid sheath and the contents of the carotid sheath. So the common carotid artery, internal jugular vein and the vagus nerve are present within the carotid sheath. The common carotid artery continues above the level of C4. It splits to form external and internal carotid artery. So above the level of C4, so we know the thyroid gland is extending from C5 to T1. So it is related to common carotid artery, internal jugular vein and vagus nerve on posterolateral aspect. And posteromedially we are having two muscles, two ligaments and two nerves. And anteriorly it is covered by the strap muscles. And here we can see the superior thyroid artery, which is a branch of external carotid artery. So superior thyroid is a branch of external carotid artery, and inferior thyroid artery, it is a branch of thyrocervical trunk. And medially we can see a nerve here. This is the recurrent laryngeal nerve, which is related to the inferior. So we can see the inferior thyroid artery and recurrent laryngeal nerve are close to each other near to the gland, and they are away from each other as we move away from the gland. So during thyroidectomy, the inferior thyroid artery should be always ligated away from the gland. It should be always ligated away from the gland to protect or to preserve recurrent laryngeal nerve. And coming to the superior